In Chapter 19, Lesson 2, we're going to talk about using medicines wisely. Most people make good decisions when using over the counter prescription meds, but there are a lot of people who are tempted to take more of a medicine or take someone else's prescription because they feel their symptoms or their illness warrants it and they think it's going to make them feel better. When it comes to medicines, we do have some standards, and it's important to understand that we have an organization called the Food and Drug Administration. All medicines must meet the standards that are set forth by the FDA. Sometimes a drug hasn't yet completed all its clinical trials set forth by the FDA, but it's thought to be effective on people with life-threatening illnesses. Just imagine if I created a medicine today that in tests showed that it could cure some cancers. We'd want to rush that to the market with some testing, but we might want to get it in the hands of people who really, really need it. And typically those people sign a waiver saying they're taking an experimental drug, and we'll really see if there's any effect on these people, based on the clinical trials. Hopefully there's a real positive results. When we discuss the FDA, it's important to understand that the FDA does not regulate herbal and dietary supplements. Supplements have really kind of boomed on the market the last 10 or 15 years. And many people, they believe they are safe because they're advertised as natural. They have claims of certain chemicals or herbal supplements, herbs in them that are good for you, that aren't going to be chemicals that our body would reject, but they're things that we typically don't need. We shouldn't believe everything they claim. Just like 5-Hour Energy says it's natural, it's this, it's that. More often than not, it's too good to be true, and it's just an energy drink that our body really doesn't need. And energy drinks are a great example of having wild claims unsupported by the FDA. A great example is Red Bull says the Red Bull will give you wings. We all know it's not going to give us wings. It's all going to give us just a little bit more boost of energy with the sugar and caffeine. And really, it's not doing anything great for our body that proper diet and exercise wouldn't do alone. So let's talk about the different types of medicines that are out there. In terms of taking them and following the directions and using them wisely, we have to understand there are two main types: prescription medicines and over-the-counter medicines. Prescription meds are medicines that are dispensed only with the written approval of a licensed physician or nurse practitioner. Most of you have likely gone to the doctor, been prescribed some sort of cough medicine, some sort of pill to cure whatever illness you might have. Strep throat is a common one where you might get some sort of antibiotic like penicillin or amoxicillin, and most teenagers have been prescribed multiple drugs over the course of their lifetime, just depending on your level of health. They provide only the amount of medicine that is needed to treat your condition. You don't get extra, you certainly get just enough to cure whatever it is that ails you. If you get 10 days worth of pills for strep throat, in the course of that 10 days, it should effectively destroy the bacteria that's causing the strep throat. We also have over-the-counter medicines you can buy without a doctor's prescription. Lots of examples out there: ibuprofen, NyQuil, Sudafed, Tylenol. I'm willing to bet most of you could go to your bathroom, your medicine cabinet, wherever you store these type of medicines, and make a long list of things that you have in your house. We go buy things like NyQuil at Cub, Walgreens, Walmart, Target. There are aisles and aisles of these things near the pharmacy that we can just pick up and go to the register and purchase. We don't need a doctor's note for them. And of course, we're usually not going to use the whole package right then and there over the course of that illness. If I have a cold, I might use NyQuil for a couple nights and it sits in my bathroom until I need it again, which is nice, and those things tend to accumulate. Again, that's why a lot of you have many of these things in your house. When we take any type of medicine, whether it's a prescription drug or an over-the-counter medicine, we really need to make sure we're reading the label as closely as we can. The FDA requires that all prescription and over-the-counter medicine labels contain information telling customers how to use the medicine safely and effectively. Yes, you can get directions from your doctor, but are you going to remember that today, tomorrow, and next week? It's important to have it right there on the label for us to access. Prescription labels must include special instructions. If there's a certain time of day or certain food, or maybe take it with or without food that you need to know. The doctor's name, the patient's name, pharmacy's name and address, the date the prescription was filled, the prescription number, whether refills are allowed. What this really prevents is people selling prescriptions, getting in the wrong hands, or should something happen to somebody where they become unconscious, pass out, and someone else is responsible for getting them their medicine. Everything is there that they need to help that person should a unforeseen circumstance arrive. Taking a look at this picture, this kind of gives you an idea of what to see with an over-the-counter medicine. This looks to be a bottle of like Pepto-Bismol. Starting on the top left, we see active ingredient that is listed, inactive ingredients. Sometimes that's important to some people because of allergies or allergic reactions. Uses, what it can be used for. Some medicines can be kind of versatile. Tylenol isn't just for a headache. It can be used for muscle pain and things like that. So it's nice to know on the label where and when we can use it. Certainly we want to know about warnings, things that could have happened if that are unforeseen, especially side effects or allergic reactions. Over on the right, expiration date. Again, some of these things sit in your cupboard for a long time, and we want to know how long they're there. Just like a can of soup in your cupboard, you don't want to take something or eat something that has been expired, especially for a long, long time. Purpose kind of goes along with the uses, why we're going to take it, what we're supposed to do with it, and other information and directions. Every medicine is going to have some different details on it, and it's important to know what we're looking at and maybe learn a little bit of something about it. Unfortunately, not everybody uses medicines the way they should. We do have medicine misuse, and a lot of it can be unintentional. We're talking about using a medicine in ways other than the intended use. Yes, you may use Tylenol for a headache or a muscle pain, but maybe somebody uses it for another illness that they don't know a lot about. Maybe it's a stomach cramp or a bad cough with your lungs, where it's just kind of not using it for what it's intended. Probably not doing the proper research to effectively help whatever illness that you have at the time. Some other examples include failing to follow instructions on the package, giving a prescription medicine to a person for whom it was not prescribed, or taking another person's medicine, which may sound crazy, but if you have similar symptoms or you are taking a medicine for something very common and you think that it'll work for you because it works for them, you never know how someone's body is going to react to those things. Taking too much or too little of a medicine, stick with the directions. Taking a medicine for longer or shorter period than prescribed or recommended. I mentioned earlier that you may get 10 days of a pill for strep throat. Well, maybe after 6 or 7 days you start feeling better and don't have a sore throat anymore, but that bacteria may still be in there and might need a couple more days to be effectively killed and thoroughly killed, where if you stop taking the medicine, maybe it can regroup and come back. Discontinuing the use of medicine without informing your healthcare provider. You really should let your doctor know if you're changing anything based on their recommendations for you. And certainly you don't want to mix medicines without the knowledge or approval of your healthcare provider. A lot of times these medicines work well with other medicines or don't work well with certain prescriptions, and your doctor really needs to know if you're mixing anything. Discussing medicine abuse here is going to be a little bit different than misuse. Misuse is often unintentional, accidental, or someone just kind of being ignorant or naive of the situation, not really knowing what they're dealing with. Medicine abuse, on the other hand, is where somebody intentionally takes medicines for non-medical reasons. You'll see that more when we get into the illegal drugs or people using drugs for the wrong reasons in the next couple chapters. 96% of teens use medicines correctly. We really don't see a huge problem with medicines at the teenage level, partly because they're expensive and they're hard to get your hands on, and we see it with older populations a little bit more. Abusing any medicine is dangerous and illegal. Drug overdose is certainly a risk, which is a strong, sometimes fatal reaction to taking a large amount of a drug. Understand, when you hear the word overdose, we're not necessarily talking about death. We could be talking about somebody who passes out, gets real sick, needs to go to the hospital, get their stomach pumped, possibly unconscious, and at risk for going into a coma and dying, but it isn't necessarily mean instant death or anything like that, but certainly very, very dangerous, something that we want to avoid. And when it comes to abuse, some things that we do see is, especially at the teenage level, people using drugs to lose weight. They think that taking some sort of, typically a stimulant, might be something that decreases appetite and increases your metabolism to burn calories. Well, the best way to lose any type of weight is through diet and exercise. We'll talk more about that in Unit 4, but people want to have the quick fix. They want that magic pill to make them lose weight today. Another one, don't use drugs to stay awake while studying. Have another can of Mountain Dew. I certainly don't advocate for energy drinks, but having something with a little bit of caffeine in it, it would certainly be a better choice, or a cup of coffee, than taking pills that are stimulants or an illegal drug that's going to keep you awake. And don't use drugs to fit in with peers. We certainly don't want to give in to peer pressure where we're making a choice not based on our own values and decisions. We're going along with the crowd, which is never a good idea.